You know, I've been covering the ins and outs of healthcare overhaul, and we're about to end another week of healthcare madness and big government confusion. The president becomes the talk show guest-in-chief this weekend to sell a plan for which the broadcast media, its cable little sisters, and the crumbling Eastern print oligarchy would like you to believe that you're not well educated enough to understand, that you're too culturally and racially insensitive to want to understand, and you're just confused about health care. Well, you're not confused, you're concerned. Because when you do the math, it doesn't appear to add up. It appears that you're disgusted at being played first and then attacked as mindless tools of right-wing rabble-rousers. The proponents of big government-run health care publish a new and different set of numbers every day, and they're trying to convince 270 or 280 million Americans that they should blow up their health care in order to bring 30 or 47 million people to the health care table, depending on the latest spin. They tell you that failure to walk lockstep with the president and the Congress is a moral defect of which you should be ashamed. That we can insure 30 million new people, but of course not illegal aliens, and it won't cost you or the government a dime. And now the Congressional Budget Office, after being taken to the woodshed by the president earlier in the summer, when they uncovered hundreds of billions of dollars of real deficits in the House plan, tells us that the Baucus health plan is going to earn you $49 billion. Well, that's a lot of free lunch. Is that believable? It's about as incredible as the federal government opening up new government cooperatives in what may mean the end of private health insurance. As incredible as telling our oldest and sickest Americans that we will cut your health care by $500 billion, but in the process you will lead healthier, longer lives. And sorry about all that death talk. Telling you that those unnecessary tests and surgeries and stents and hips and knees may make you feel better but not live longer, that Father Government knows best. Better than the doctor who's helped keep you alive for the past 10 years. You lived through World War II and Korea and Vietnam, but step right up here and turn in your scooter at the Capitol in the name of the collective. You have COPD and diabetes and arthritis, but real Americans don't need wheelchairs. As incredible as promising 30 million more Americans coverage to be treated by 150,000 fewer doctors by 2025. Around the same time, my wife and I will be eligible for Medicare, and if the plan goes through, 45% of our doctors say they will consider leaving the profession. As incredible as government mandates and fines for noncompliance and steep taxes on even middle-class health insurance policies. And as incredible as the staged public attacks on big pharmaceutical and the insurance industry, while the White House privately agrees not to negotiate Medicare drug prices, and the Senate figures out ways to decrease your rate of reimbursement to be paid by insurance companies. I say keep on doing the math. The next time someone tells you you're angry and confused, you tell them you've done the math, but it doesn't add up. I'm on Twitter, Peter Johnson Jr. Let me know what you think. We'll be right back.